Very good evening, everybody. Meeting again in the session of Materia Medica, and today we're going to learn one more remedy from fourth year syllabus. It's an Indian remedy, and it is included in our syllabus. That is another good sign because it has a wide use in respiratory tuberculosis. There are many medicines mentioned in the tuberculosis in homeopathy, but there are many cautions regarding use of all those remedies. We have Kalika, we have phosphorus, we have tuberculinum, we have earth iodide. There are many more. But question arises that everywhere, whenever the doses are mentioned, there is always a question mark that you should be used it very cautiously. It may produce hemoptysis or all those things which are there. But this Indian drug is a wonderful remedy in homeopathic system of medicine. And that's why today we're going to learn this remedy, that is Indian nettle, that is uh, Acalypha Indica. Acalypha Indica is the remedy which I have used in first time I have used in a patient who was suffering from a recurrent tuberculosis. 5 times he has consumed anti-tubercular treatment, every time 6 months, sometimes 9 months, and he had a recurrence. He used to feel better after ATT nearly about a year or two, and then again he used to suffer. So he was right from his young age till when he met me, he was 65, and he had 5 times tuberculosis, and this is sixth time when he came to me and having a hemoptysis. His son was there, and he said that, sir, he had 5 times up till now. This is sixth time he is having tuberculosis, and doctor is saying that he has to again start TB drugs. But last time there was a resistance, and we have to purchase very medicines, allopathic medicines, which were too costly. And this time also they are saying that we have to use the similar type of treatment. He was investigated and having found, yes, again it is an active tuberculosis, and he is having a racking cough, hard racking cough, where you can listen the rattling over there along with the hemoptysis. Hemoptysis was a bright red blood which is there in the sputum, and he has shown me the photographs, yes, how this sputum comes, bloody sputum comes over there, and it used to get aggravated in the morning. So this was the case where active tuberculosis, it is an active tuberculosis case, and he was sitting in front of me, and there was a rumbling sound inside his abdomen, which was audible to me in front when he was sitting in front of me. Then I asked, do you get such types of noises in your stomach? And then he suddenly recollected, doctor, that also I have to say that since I have taken this so much of medicines, I used to get very often the diarrhea, and it is very noisy flatus which passes, noisy rumbling diarrhea, and I have suffered a lot, and that's why I don't want to take those medicines again. And we are there in front of you for taking the homeopathic treatment. It was very early in my practice. It was in 1996, 97 case was there. And everyone have told me regarding that to deal with tuberculosis without anti-tubercular treatment is always a dangerous, and it may cause aggravation or sometimes hemoptysis and many more things. And it is already given in the books also regarding the phosphorus and cardicarb and tuberculinum, all those things were there in the dose spectrum. So question was there in my mind, but I was very thorough with the Boix Materia Medica. So I was knowing Acalypha Indica is a Indian drug which is very commonly used in treatment of tuberculosis, even in active phase of tuberculosis, and this remedy works. And when I read that remedy again, I found this is the remedy of the patient. So I have started him on Acalypha Indica 30C, and 30C 3 times a day. I have given it for 3-4 days, and I asked him to meet me after a week. And when he entered, there was a big change on his face. First important thing, that the weakness which has been developed because of tuberculosis earlier, he was not getting proper food, appetite was lost, and he was having that diarrhea, and that's why he was looking dehydrated and old looking. And all of a sudden, within a week, there was a big change. The cough has settled, the hemoptysis has settled, and most important thing, he started getting an appetite. He felt hungry. When he first visited, his weight was 50 kg, and after within a week, he gained 2.5 kg. And he said, "Doctor, I have not seen such type of result with the anti-tubercular treatment, but with this medicine, I felt very much hungry. I'm eating three times a day, and cough has literally stopped. 90% of my cough is stopped, and there is no diarrhea." I have continued him on placebo. I asked him to meet me again 15 days. After 15 days, there was 2 more kg weight gain, and Acalypha Indica was working. Then after a period of 1.5 months, he again had little bit cough with hemorrhagic sputum. So I have repeated 3 more doses of Acalypha and asked him to meet me if it never stops. But he met me again after 15 days, and there was no recurrence. And this fellow becomes my regular patient, and he gained weight up to 65 kg, and he was absolutely normal. Then he stopped the treatment, he was not coming, and all of a sudden, after a period of 2.5 years, he again returned one day with the similar type of complaints. In between, he was absolutely good, nothing was given, no allopathic treatment was introduced. And then he again came to me with the similar types of symptom. And what has happened, he has consumed very oily food, and along with that, he had again started taking a tobacco, which I have already stopped with him. So I scolded him regarding this, and then he said, "Okay, I apologize, and I will stop that." And then again, I have worked out with the case and found to be a same remedy, and I have given it in same manner. And within span of week, it started working and it stopped the problem. So without any anti-tubercular treatment, allopathic treatment, or which is called as allopathic chemotherapy for tuberculosis, has not been introduced, and with the help of homeopathic remedy, it works so beautifully. So this is the wonderful cure of tuberculosis with the help of Acalypha Indica. I have worked out with that phase. So that was interesting case to share with you. And then we'll open the Borixma trimedica, the remedy Acalypha Indica. It is from Iparbaceae family. It is Indian natal. A drug having a material marked action on the alimentary canal and respiratory organs. It is indicated in incipient tuberculosis. Thesis is tuberculosis with heart-racking cough, bloody expectoration, and blood is arterial hemorrhage. It is blood which is bright red, but no febrile disturbance. That is one more important thing which I forgot to tell you, that there was not at all a fever in that case. So that is again a typical with the Acalypha indica without febrile disturbance. Patient is very weak in the morning and gains the strength during the day. So patient is very weak in the morning aggravation is there, and as the day advances, as the sun comes up, they feels better. Progressive emaciation, all pathological hemorrhages having notably a morning aggravation, and this is very typical with the Acalypha indica. Chest, the cup is dry, hard, followed by hemoptysis, worse in the morning and at night. Constant severe pain in chest, that is one feature which is very important. Blood is bright red and not profuse in morning, dark and clotted in the afternoon. Pulse is soft and compressible. So that is very important. Pulse is soft and compressible. Burning in pharynx, esophagus and stomach. Abdomen, burning in intestines, the spluttering diarrhea with forcible expulsion of noisy flutters, bearing down pains, and tenesmus. And this is one more feature one should not forget regarding the Acalypha indica. Some even if you go through the Vitolka's Mathematical Vaiva, he has mentioned the case which is explained over there in that related with it, and it is a case of diarrhea with a profuse bleeding per rectum and treated with the Acalypha indica over there. It was the case which was wonderfully explained over there. So those who have that book always read that. Rumbling distension and gripping pain in the abdomen, rectal hemorrhage worse in the morning. So morning aggravation is very typical of this remedy. Skin, the jaundice, itching and circumscribed furuncle-like swelling. Then drenching night sweat. That is one more thing which is not there, but add it over there. That is tubercular feature which is there. The chronic of Acalypha indica is always phosphorus. Compare milefolium, phosphorus, acetic acid, kali nitricum. Tubercular diathesis, the hemorrhagic diathesis that is characteristic of this remedy. The modality, general modality, works in the morning, and dose mentioned by Boric is third to sixth potency. Yes, sixth is good, but my suggestion is always that you must go for 12C or 30C. That will be a better potency to be utilized in if you have such a case of active tuberculosis. During active phase, either this remedy or R-iodide is another remedy which is very useful if there is associated with scrofulous diathesis, then you must think about the R-iodide also. The phosphorus, kali carbonicum, tuberculinum, these are the remedies. One should not go in active phase, or one should not prescribe in active phase. Many times they are dangerous for the patient. So my suggestion is always that you must think about Acalypha indica, and it is a wonderful remedy to be utilized in active tuberculosis. I have utilized it with many patients in active phase of tuberculosis. So that's all regarding this Acalypha indica, a short remedy but having very specific use in tuberculosis. So thank you, and be there after Diwali vacation on 5th of November. So on 5th of November, we're going to start again the sessions, both the Organon and Mater Medica. In between holidays, and very, very happy Diwali to all of you, and enjoy your Deepavali festival, and be there on the 5th of November to learn further remedies as well as Organon right from the 5th November. So thank you and good night.
Thank you and happy Diwali, sir.
Yes.